Morning, everyone. We'll give it just another few seconds here to let everyone log in. Okay. Good morning, everyone. Thank you for joining us for our February Medical Matters. We're happy to have Dr. Ilodi with us again this month, our Medical Director. Welcome. And today she's going to be talking about a topic that can sometimes be difficult to decide. When is it time to consider stopping driving? So she's going to talk about some factors to consider and considerations to give towards when it's time to consider stopping driving. So welcome. Good morning.
Good morning, everyone. Thank you again for having me. I'm Dr. Yoleetah Ilodi, the Medical Director of Kendal at Home, and I'm just so grateful to be among you guys this morning. So a topic that is near and dear to my heart is driving and older adults, and when is it time? I like to tell the story about my grandfather who, he's been driving since the age of 12. At least that's what he tells me. And, I when I first went into geriatrics, I would say, who do you want to tell you when it's time to stop driving? And he was so confused and bothered by the question. And I said, no, Grandpa, we call him Pawpaw. Who do you want to tell you when it's time to stop driving? And he would tell me, you're going to have to pry those keys out of my cold, dead hands. So I just have to say that because still to this day, he drives, he's in his 90s. He's a very good and careful driver, but he is still driving. And I know it is that's when I realized how difficult the topic is because there was no way anyone was going to take those keys from him. But in some folks, that might not be the case, and it may be time to retire driving. And so just to have a little bit of discussion about that.
Dr. Ilodi, before you progress, can I just make two mentions that I failed to say? If you have any questions throughout the presentation, you can type those questions into the Q&A box at the bottom of your screen. And if you click on View at the top right and place the presentation in speaker view, that will allow you to see Dr. Ilodi and her presentation only on your screen. Thank you. Sorry for that.
So I always throw in a case because I like for us to imagine us going to the doctor, either if you're going to decide you want to be a primary care physician or just even ask the patient, excuse me. So this is Miss Rose, and Miss Rose is a lovable, very active 82-year-old widowed female. And she goes to her primary care physician for a routine visit. She has a past medical history of heart disease. She's got some anxiety. We call that the worried well, nothing too drastic, and some macular degeneration of her eyes. Most recently, she was told by her ophthalmologist that she should restrict her driving to daytime driving because of her macular degeneration. She's had one or two near misses while in the grocery store parking lot. Her children live 2 states over. She takes aspirin, eye drops, and Xanax. So during the conversation, she questions when should she stop driving? And so it's not clear why it is clear, why people are so reluctant to stop driving. We can all understand that, right? And as a physician, I often ponder this when either the patient will ask me or one of their children will ask, sometimes their sibling will ask, when is it time for them to stop driving? And that always goes with a reason, right? You always know that when that question comes up, there's a story behind that question. So when I first started geriatric medicine, I was just 30 years old. I've been doing this for about 12 years. And, you know, I would have to tell people when it was time for them to stop driving. And I would say, it's time for you to stop driving. Or I sometimes like to use the verbiage, it's time to retire from driving, because retirement is a good thing. It's a celebration, right? And then I would get a lot of, I've been driving longer than you've been born. and I say that as a very true statement. And I just want to say that for the most part, our seniors are engaged in healthier driving practices than our younger generations. So again, for the most part, individuals over the age of 65 are safer drivers. And we know that even still to today, so even though my grandfather said he's been driving since he was 12, and I believe that because he doesn't come off as a liar. He's my grandfather. But, you know, still today, you know, Alaska, I wrote it down, Alaska, Arkansas, Iowa, Kansas, North and South Carolina, Dakota, excuse me, you can get your driving permit at 14 years old. I didn't know that when I looked that back up. So, and driving brings independence. You can go to the grocery store, to church, to get things that you need, your doctor's appointment. You can go visiting. If you want to walk the nature trails and you could drive to the nature trails and do all those great things. It lends a great amount of independence. And when that is taken away, it can become debilitating and isolating. And so this is my favorite one. So is driving easy? And so I'm going to kind of move here. So is driving easy? You know, I get a lot of times, again, I've been driving since longer than you've been born. I ask myself, is driving easy? It's easy, right? Well, no, it's a lot of muscle memory. I think we've all had those moments where we have driven home after living in the same place for so long and say, how did I get here? And it's a lot of muscle memory. But it's very complex, and it's a combination of attention span, tracking, vision, hearing, flexibility, like quick reflexes, cognition, such as reasoning and judgment. You know, if we could just think about just getting onto the highway, right? The entrance and the exit ramp. That's a lot of reasoning and planning and timing. And it's also that everyone ages differently. And just with the normal aging process, some of these start to dull, start to decline, and it will affect driving overall. So I'm going back here because what I want to say is statistics is big for me. If you know me, numbers are huge. Numbers, I always say numbers don't lie. And this is very interesting in the fact that in 2018, more than 45 million licensed drivers were over the age of 65, which is a 60% increase since 2000. Again, driving helps individuals stay mobile and independent, but the risk of being injured or killed in a traffic crash increases as people age. Again, so you heard me say, so I'm not contradicting myself. You heard me say that individuals over the age of 65, they do indulge in more healthy driving habits. However, when they are in a car accident, they're more likely to be injured or killed. And so this was a stat here in 2018, almost 7,700 older adults were killed in traffic crashes. Many more were treated in the emergency room, 250,000. And they broke this down by numbers, which I thought was very helpful. This means that each day more than 20 older adults are killed in the United States, or almost 700 are injured in crashes. And again, so this just shows you drivers over the age of 65 at high risk of death. So I just want to show you here, if you look at drivers age around 16 and 19, it's pretty high, the death rates, when folks start to just learn how to drive and they don't have those very polished driving skills. But if you look over the age of around 70 to 75 plus, you notice that those numbers go up again. And also passenger in the same vehicle as driver, again, those numbers are pretty high. Usually that's a spouse that's also in the car. Sadly, the area, the hospital that I work at, which is a Summa Health System, is also by a University of Akron. And we do see, so you have brand new drivers in a city where there is a large amount of elderly individuals. It's not a good mix coming right off that hospital. And we've seen quite a few accidents happen that way. So Miss Rose, so let's kind of go back to Miss Rose and think about this. So the first thing I do in my assessment is history and reflection. Like I said, there's always a story that's behind that. So I just kind of take a deep breath and I'm wondering, what is her story? Now, she just admitted to 1 or 2 near misses. I want to give more history on that. What is a near miss? What your near miss may not be my near miss. My near miss is, you actually got me. So we need to really define that. Close calls. Do you fatigue easily while you're driving? Do you frequently forget where you parked or directions? Are people honking at you? Those are all of the things that I want to find out in my history while I talk to Miss Rose. If allowed, I would love to get a collaborative history and reflection. So if permitted, I usually will ask, are you okay if I talk to your family? If the family member is there, I'll pull them into a separate room and say, would you ride in the car with the patient? I don't know why I come out with the first one. I don't wait for the punchline. I come right out with it, because if I have my answer, oh no, which I have had people say right away before I even got it out my mouth, oh no, I'm not riding in the car with her. We have our answer if the person should drive or not. Has there been any crashes? Have you observed them driving? I've had some sneaky grandchildren follow along and see how grandparents are driving. Are there dings on the car or the house? Believe it or not, I've had folks with some paint from the car left on the house because they've hit the house. What are the roadways? I live out here and I call it the boondocks, we have Ravenna over here and you have these long streets. Are there stop signs? Is there good lighting? Sometimes there's just not a lot of lighting on the street, especially at nighttime. Driving violations. Are there speeding tickets or moving violations? And you can ask all of these questions to the patients. I got some very forthcoming patients. They're great. They'll just give it to me however I ask. Others, I kind of have to get it out the children or the caregiver. So after I talk to the patient and I talk to maybe the family member, now I want to take a good gander at these medications that they're on, okay? So I'm looking at the medications and I'm noticing that in the case of Miss Rose, she is on a medication called Xanax, which is a benzodiazepine, which can cause you, it's for anxiety, but it can cause you to become fatigued or tired, confused, and dizzy. We have narcotics. Antidepressants such as Zoloft or Celexa, Lexapro, hypnotics, things like Ambien or sleep aids, antipsychotics, antihistamine. You know, some folks will take a Benadryl at nighttime and maybe it hasn't worn off by morning. Eye agents, I say glaucoma, but really any type of eye agents and muscle relaxants. Maybe, you know, doing yoga or Tai Chi or something, you hurt yourself and you're on a little bit of Xanaflex or Flexerol. That can also make you very tired. So again, in our case, Mrs. Rose was on a benzodiazepine, and again, that can make her pretty fatigued. So once I look through the medication, I want to really get a good health history at that point, right? Because I need to know what their physical and sensory impairments are. Because again, driving is complex. Clearly, their vision has to be intact, right? They can't have blurred vision. They need to make sure that they're going to the eye doctor, because if you can't see, you can't drive. You need your vision to drive. Same thing with hearing. Over 50% of individuals over the age of 80 have hearing impairments. And so again, I need to make sure that they've had their hearing evaluations. Fitness, flexibility, arthritis. You can call it what you want, but if you can't turn your neck and you can't turn your neck this way to look to see if a car is coming, then again, we have a problem, because you need all of these very, it seems like baseline abilities, functional abilities, but you need all of these things to be able to drive your car. Do you have sleep disorder, such as sleep apnea? You're not getting a good night's sleep. You're tired, and we've had folks who have fallen asleep at the wheel. Cardiac disease, like arrhythmias. Are you going in and out of an arrhythmia that is going to cause you maybe to pass out? Pulmonary disease, and that's clear. If you can't breathe, you can't drive. And I put the last two down here, brain health. And we're going to talk a little bit more about cognition and dementia, and alcoholism. So we'll talk a little bit, we'll just touch a little bit about alcoholism and dementia, a little bit more. So I bring up alcoholism because, believe it or not, it is the addiction of choice. It is the drug of choice for individuals over the age of 65. And it is at the highest rate amongst widowers over the age of 75. Okay. And at many nursing homes, 50% of the residents still have alcoholic related problems. And so it would be nice to think that, you know, we get to a certain age and we just don't have a need for it. We don't want to do it anymore. I never believed that. I was raised by my grandparents, so I never believed that for one moment. But drinking can still be an issue. And so now, you're not 25. So now you have all of these medications, plus the drinking, plus the vision, plus the everything else that's going on in your body, plus your metabolism is not where it used to be, and that can create a lot of issues. That doesn't even include the issues that the alcohol alone can cause, including dehydration, osteoporosis, and all kind of other things. So Miss Rose is like, okay, I think I'm good. I only have a couple glasses of wine each week, no problem. So at this point, you're going to do a self-reflection. Okay, you're going to say, all right, what do I need to do? I can restrict my driving. So a lot of folks do this automatically, and I'm to that point where I just don't like driving at night. I don't know about you, but driving at night, I'm okay unless I really have to. So they self-restrict from driving at night too much or during bad weather. They won't drive on long trips. They make sure that if they know they have to drive, they won't take some muscle relaxants. They make sure they don't take the medications that may cause them to be fatigued. I've had some folks call in and they do a refresher course. There's plenty of refresher courses around Ohio. At the Center for Senior Health, which is in SUMA, we do a driving assessment with our occupational therapist, and that's a driving simulator. Again, you can have a third party follow you, and just periodically to make sure you're driving okay, or you can retire from driving. And, you know, sometimes this happens very organically, and I believe that that's probably the best way. And nobody wants to be told what to do at the beautiful age of 80 or 90 years old. And so that's the best way for it to happen, is very organically, as you say, you know what, it's just not safe. You know, I want to be safe. I don't want to be in pain from a car accident. I don't want to have any injuries. So it's probably just time to just hang it up, hang the keys up. So some considerations, again, when you're driving, be aware of your medication side effects. Look at those warnings on the side. Yes, you may have taken that medication for years. And I've said this to people. Yes, you've been on Xanax for 20 years, but you have not always been 80 for 20 years. Your body is different. No texting and driving. I get so afraid. I still pull over when I get a text and I feel like I have to really answer it. I just pull over. No drinking and driving. Yes, it's, you know, if you had a glass of wine at a restaurant, but once you hit 2, we're done. You know, it's just too much, and especially with medications in your system. Avoid loud music and talking. I try not to even listen to much of anything except for, you know, jazz in the car. Just anything that's really not going to be too distracting. This is my problem. Avoid eating. That's my problem. You know, if you can imagine, I eat a lot of times on the fly. So I'm working on that. If you're noticing that you're a little bit more confused or forgetful, you may want to get an assessment and just kind of pause until you get some type of memory assessment. If you found out bad news, or if you're tired, your body is fatigued, you know, that's why they make DoorDash or, you know, Postmates or whatever, you know, just kind of relax. Self-care is the best care, and consider using a navigation system. So I want to talk a little bit about cognitive impairment, because this is really this group of individuals who really have a hard time giving up driving. I think it has been easier for folks if it was due to vision or hearing or physical debility. But when we start getting to dementia, well, you don't remember what you forgot, which is what dementia is. And it can impair the ability to distinguish safe from unsafe driving situations. And it can diminish the ability to compensate for physical and sensory impairments, or even be aware of them. And I have stories of people who they've gotten on the highway, gotten into a car accident, left the scene of the car accident, and went straight to the car dealership, bought a new car, got it home, and forgot even that they were in a car accident. And it also can lead, so dementia or cognitive impairment can also lead to medication non-compliance, medication errors. So therefore, way too much, you could be taking way too much medication, which can be an issue as well. I do realize, again, as I'm going through the assessment, every piece of me does realize that me saying anything about restricting their driving or to cease driving will decrease their independence level and their self-esteem, and that the fact that their acceleration to decline increases. I do realize that the caregiver burden will increase. I do realize all of these things, but you have to balance that with their safety. So some other things that a lot of times will go with dementia, which is depression. You get a lot of slowing and decreased reaction times. Some folks I've had psychosis, and this has become dangerous. I've had a lady who had a very different type of dementia, dementia is like an umbrella term, and under the word dementia, you have all different types, like Alzheimer's, Lewy body, Parkinson's. So there's a bunch of different types. Well, she had this very interesting type of dementia, and she jumped in her car. She went after some kids. The kids were hallucinations, and it could have been that was a very dangerous situation. Aggressiveness. Sometimes I get somebody who says, you're not going to take away my keys no matter what. I'm driving, and they take the keys and they leave, and that they can get into a car accident. And then apathy, just not being able to anticipate hazards, not being able to determine and decode some of the road signs. So I put in a little bit of information because, again, when someone comes into me with any inquiry about driving, I'm getting that backstory. So one of the things that I'm going to do is I'm going to do some cognitive testing. And so some folks who have problems with their memory, they still drive, but we know it's time to kind of slow down. A few patients begin to slow down once they get that diagnosis. And this was just a brief study. Most people, once they get the diagnosis of dementia, they quit within 2 years. And that was about 60% of people. And it really depends on the type of other symptoms that they have, type of supports they have. So this is just some specific driving errors. Again, you'll see folks with dementia, worse lane control, unexpected braking, less awareness. I've seen all of this. These are a couple tests. So when somebody talks about, I think I need to, I'm questioning whether I should be driving, I'll give them these tests, more of the one that says the Montreal Cognitive Assessment. And that's my favorite because it combines a lot of different skills, a lot of different skill sets. And so especially the first top part where it says visual spatial executive. And so that helps me a whole lot in the terms of, so the executive function is responsible for like that reasoning and mapping and planning in your brain. So these are a couple other tests, and you probably saw the smaller version here. And so that's just a smaller version of the test at the top part. These are the larger versions. So this is called the Trails B. Again, this is a test in divided attention, right? So when I give this test to somebody, I'm trying to see how well they're able to plan, reason, and divide attention. And this next one with the clock, we do the clock drawing quite a bit, which has been correlated with driving injuries. And again, this shows this clock here, it was supposed to be 10 after 10. Pretty, not too bad, not too good. I've seen worse. But one of the best things is if you're going to really try to figure out if you should be driving, we do what is called a driving simulation. We have one up here at Akron City Hospital, also known as SUMA. We have the driving simulators at Kent State. I know there's one also at UH. I'm not quite sure if there's one at Cleveland Clinic, but again, it's a great one because you have a simulation. You'll have like road signs coming at you, and you have to be able to decipher what that sign says, and it'll kind of change the effects of it. It's it could be a 1 hour test depending on how you do to a 3 hour test. And that's what it looks like. It still looks like that. It looks like, I know that looks like a old 1970s computer, but that's still what it looks like. So once I have them do the driving simulation, depending on how they do, I might need an on the road test. I don't do the on the road test first because it can be I need to know if they know the signs of the road. And I need to know they know how to do the basics before they go for a road test, which could be dangerous. And depending on how they do with both of those will determine if I say continue to drive with no restrictions, drive with restrictions, drive with a large amount of restrictions. And that's usually like, I usually say things like, let them drive to church. You be in the car, it's only 2 minutes away, let them drive to church, that's it. And then cease driving. And the way that works in Ohio is that we have to renew our license every 4 years. However, regardless of age, if anybody can write to the BMV and say that this person has blank cognitive impairment, I'm worried that they should stop driving. Once that happens, then you'll get a letter saying that you need to be retested. And a lot of times when somebody has dementia, I'll send that letter in because of their dementia. They won't know, they will forget to bring it back into me. And then their license pretty much will become expired. I usually will tell them, I need you to bring that letter in because I want you to get formally tested with somebody from the BMV. But again, sometimes that doesn't happen just because of the sheer amount of dementia that they're dealing with. So that is my presentation. I appreciate your time. And of course, if you have any questions, these are my resources. If you have any questions, please let me know. I'm very happy to answer them.
Thank you, Dr. Ilodi. If you have any questions, you can type them into the Q&A box below. A couple things that come to mind is sometimes primary care physicians are not ones that like to typically have this conversation about when it's time to stop driving, and sometimes are reluctant to even send that letter to the BMV. So if a family member is concerned, maybe they've had that discussion with a primary care physician, they're not getting the feedback that they had maybe hoped for, is that an appropriate time to reach out to a geriatrician for that assessment?
Yes, geriatricians are notorious bad guys, and we're okay with being the bad guys for the primary care physician, you know, and we said it, we get we'll get a call from the primary care physician. He goes, she's been my patient for 20 years and I really adore her, but I know she shouldn't be driving. I don't want bad blood between us. And so that's okay. And I'm okay because they'll see me, you know, once a year, right? But you want that relationship to still be like glue. So I'm okay with telling them, like, look, I like you, but I don't want to see you in a car accident. So I'm going to say that you can't drive. And I'm very upfront with them. They know I'm sending the letter. There's no hiding. But yeah, that happens quite a bit.
You mentioned resources in those situations because, of course, for a lot of people losing that independence, being able to go to the grocery store, do you have a social worker that you work with, or in your practice, does the physician provide resources to individuals?
So yes, absolutely. So we have a wonderful social work team who compiles a folder depending on what the needs are of all the resources in their county. And you can also get that from the Area Agency on Aging. And they have all of those resources as well. And I also, you know, if I know a lot of folks are, you know, savvier with the computer, right? And just Googling, you know, this is what I need. And a lot of people are able to do it. There's a lot of folks even on care.com now who are just willing to be the go-between for some of our older adults.
Sure. It looks like Jody has a question. She's asking, by glaucoma agents, do you mean a drop in the eye at night or something else?
No, so when we speak about glaucoma agents, a lot of glaucoma agents are, I talk a lot about, there's two types, there's closed and then there's open acute. So I'm more talking about something a little bit more severe than most folks have. where you're going to have a large amount of pressure in the eye, and it's going to start to bulge a little bit, and you get some blurriness.
Something else that often comes up is who pays for these assessments, especially the on-the-road assessments. In the past, there's a lot of talk that they hadn't been covered by insurance. Are you finding that insurance companies are more likely to cover these now, or are these more private pay situations?
That's a wonderful question. So a lot of them are going to be for the on the road will be private pay, and they range from, well, here I know our Wally is we call him Wally. He does our testing. He's about $90, which can be pretty fierce, especially if you're on a tight budget. And so I really try to look at the simulation and see where we stand, because insurance will pay for that.
Okay.
The simulation, and that's covered under occupational therapy.
Okay, perfect.
Dr. Ilodi, I would love to share just a word of caution. I've just gone through this with my 90-year-old dad who has macular degeneration. And, I take him to doctor's appointments, drive him pretty much anywhere he needed to go, and have been for a long time. But he still drove, volunteered 3 days a week. This is all prior to the pandemic, and drove to church. And if he needed something from the store, and when I took him to the doctor and they did the vision test and I saw how impaired his vision was, I looked at the doctor and said, should he be driving? And he said, is he driving? And of course, yes, he is. And my dad was very open. I knew this was coming. I haven't been able to see the stoplights changing colors for a long time. And what I realized at that moment is I've never driven with my dad because I always drove him. So I had no idea how hesitant he had become, how impaired his driving was. Thank God he never had an accident, but I never knew because I would pick him up and I would drive him anywhere we went together. And I never had him drive. So it wasn't until that day in the doctor's office. Fortunately, he very willingly gave up his keys and has never driven again. But I learned a lesson that, when I spoke with my siblings later, my sister said, oh, yeah, I drove with dad once. It was terrible. And I'm like, why wouldn't you say something? We had no idea. So I think it's just a word of caution that if we aren't letting them drive and we don't see or observe it, it's hard for us to know the challenges that they might be dealing with.
That's a very great point. Observation is key. And I love what this one family did. They had the grandsons just said, Grandma, we're just going to follow, the older grandsons were 18. We're just going to follow you home and make sure you get in the house okay, but the whole time they're just kind of doing detective work and watching her drive. And they said, oh, Grandma drove awful. She was on the line, because I think when the kids do it, they kind of suspect what the kids are doing, but they never suspected. And it's something you have to do. And you have to balance the safety part of it. And it is what it is. You have to balance that safety. Yeah, my grandfather finally stopped driving because he was driving. He has an Escalade and he was driving over small animals. And I was like, it's time to stop.
It is a difficult thing. I would be right on his side. I don't ever want to have to give up driving. It's, that independence that you give up along with it. And so it is a challenging situation. It is one that members, I know I've had conversations with adult children of members and they say, I'm never going to tell my parents you are. And I say, no, I can't. It's really not up to us. We'll make recommendations. We'll help connect them with those driving assessments and all of that. But ultimately, we don't have the legal authority to tell anyone what they can or can't do. But I think it is so important just to know what's out there, what resources, how we can best evaluate. Maybe they can still drive, but needs just some brush up on classes that we could probably all benefit from, right?
Yes. Yeah. Refresher courses are so important. And there's a lot of places for brain health. I know there's one out in Beechwood, But there are several. I mean, they're kind of all around, drizzled around, and I would say, start off with those basics. That if you're texting, or if you're tired or you're stressed, start off with those very basic things that you can do yourself, and then do those refresher courses.
Mhm. Thank you. I think we have answered any questions that anyone had in the chat box. So thank you so much, Dr. Ilodi, for being with us today. We appreciate it. It's always great to see you.
Good to see you. Good to see you. Well, bye everyone, and thank you again for coming on.
Thank you.
Thank you.
Bye bye.